The way I like to think about this is it's like our bodies, our brains, our nervous system are like a house that was built in a different generation. And we have this electrical system that maybe in the 1950s it made sense. You had a refrigerator, maybe one or two appliances, a few things plugged in. And now we're charging our cars. We have 5 computers and 18 phones and a gazillion different things. And the house just was not built to handle all of that. It was built for a different time. And that's basically what's going on with our nervous system. So it feels like a personal failing, but it's simply because we didn't evolve as a species to handle all of the information that we have. Hey everyone, welcome to another episode of JAMA Lab. Great to have you back with us. Really excited. We've got an amazing cast of characters here today with us. Of course, we have Richie Davidson, our dear friend and one of the most well-known and respected neuroscientists on the planet. And we are joined by Leandro Chernikov and Daniela Labra, who are two of our very, very long-term dear friends, collaborators, colleagues, Dharma brothers and sisters. Super happy to have them on. So just to say a little bit about the two of them, some of you might know Daniela is actually one of the guides in the Healthy Minds program app. So you might have already heard her, even fallen asleep to her voice, listening to a guided meditation somewhere along the way. In addition to her work that she does with us at Healthy Minds, she's a longtime meditation teacher, a very gifted public speaker, and she's also the co-founder with her husband, Leandro, of Atentamente. And Atentamente, we're actually going to hear a lot about this. This is one of the coolest organizations on the planet. Whenever I'm talking to other people about just really cool stuff in the world of meditation and contemplative science, I always mention their work. Richie, I'm sure you do as well. So the stuff they're doing and that we're going to hear about today is really groundbreaking, world-changing kind of work. Leandro is an equally remarkable individual. He's a scientist. He got his PhD, as I did with Richie, at the Center for Healthy Minds. Like Daniela, he's also been a long-time meditation teacher and has been studying, practicing, exploring these things for decades. So we've got a collective body of experience here on this call that I think is quite extraordinary. And we're going to talk specifically about the topic of burnout today, which is the main topic of the research that they do, and a really cool paper that just came out in the Journal of the American Medical Association, a very high-profile, prestigious scientific journal. And we wanted to draw out the bigger topic of burnout because it's something that all of us feel. I'm sure that even those of us on this call, like we do this for a living. We talk about this stuff, we explore this stuff, and we're probably all on the edge of burnout, honestly, if we're totally honest. The world is just throwing so much at us these days. So today we're going to talk about burnout more generally, specifically this very cool study that they did in Mexico and the broader implications of that, not only in the healthcare system where the study was done, but more broadly for all of us. But I think especially to talk about not only why burnout happens, the implications of it, but really what we can do about it, and some simple steps that we can all take that even in minutes a day can actually rewire how our brains work, retrain our minds, so we can cope with the crazy pace of the modern world in hopefully a healthy way. So I wonder if we could talk a little bit about why this happens. For when we feel burnout, I think one of the challenges is it feels personal. It feels like we're failing somehow, like we should be able to handle it better. And it feels as though it's somehow our personal issue. It's a personal shortcoming, and we just have to deal with it. I wonder if you could just share a little bit about the neuroscience, the biology, like why does this even happen in the first place, and what do we know scientifically?
Yeah, thank you, Court, and also thank you, Daniela and Leandro, for all the amazing work you guys do. Just before we get to that, on the topic of burnout in healthcare providers, just to be specific, in 2024 in the United States, there was more than one physician suicide a day in doctors, more than one physician suicide a day. The total number was around 425. This is really unprecedented. It's the rates have really been skyrocketing. And at least in the United States, I'm not sure whether similar trends are in Mexico, but there are a few medical specialties that are particularly challenged with respect to burnout. And one of them is emergency room medicine, might not be surprising. Another is specialties where Western medicine just has not been super effective. One of those is actually in GYN oncology, where the cancers that these physicians have to deal with are not very responsive to currently available strategies in medicine. And so a lot of patients die. And this is, of course, super stressful for the healthcare providers. So just getting back to your question, I mean, one issue is something that you mentioned, Cord, at the very beginning of this episode, which is simply, and the way I put it is we are all participants in a grand experiment for which none of us have provided our informed consent. And that grand experiment is this, new, quote, information age in which we're living, and the rate at which we are recipients of information is unprecedented. And this creates a constant kind of stress that humans have never faced before in human history. And so, I certainly think this is one really important contribution. And one of the unique things about our biology as humans is that we have this big chunk of real estate in the front of our brain called the prefrontal cortex. And this helps us in many ways and confers enormous flexibility and possibility for humans. We can anticipate the future, and we can reflect on the past in ways that far exceed what any other species can do. But this is also what can get us into trouble, because we can worry about things in the future in ways that far exceed what other species can do. And one of the things I often say, although we don't really have good evidence about this, but I think most people would agree that the prevalence of psychiatric disorders is much greater in humans than it is in any other species. And the reason it is because of our prefrontal cortex. And there's a very famous neuroscientist at Stanford by the name of Robert Sapolsky. And Robert wrote a book once called Why Zebras Don't Get Ulcers. And in a nutshell, the reason why zebras don't get ulcers and why humans do is because zebras have a really puny prefrontal cortex. They can't anticipate the future and reflect on the past in the same way. But of course, anticipating in the future and reflecting on the past really can ensnare us in our worries and in regrets about the past that really can trap us. And this is where contemplative practices can really be helpful in allowing us to change our relationship to these events. We're not going to change the rate at which information is coming because that's really beyond our control. But what is in our control is the capacity to transform our own minds.
Yeah, the way I like to think about this is it's like our bodies, our brains, our nervous system are like a house that was built in a different generation. And we have this electrical system that maybe in the 1950s it made sense. You had a refrigerator, maybe one or two appliances, a few things plugged in. And now we're charging our cars. We have 5 computers and 18 phones and a gazillion different things. And the house just was not built to handle all of that. It was built for a different time. And that's basically what's going on with our nervous system. So it feels like a personal failing, but it's simply because we didn't evolve as a species to handle all of the information that we have. Or just one example that is salient from my life is after living in Asia for many years, I remember coming to a grocery store, just a normal experience we have all the time. And it just suddenly occurred to me that we are making constant choices that are in the past people never had to make. Like you didn't have 18 brands of toothpaste and 4 different kinds of oranges and 5 different choices of what to have for dinner. Like constantly, all the time, we're making choices, and it's just normal. We just are. It's just the world we're living in. We don't think about it, but there's this low-grade chronic stress that just creeps in, almost without our knowing it. So let's go back
That
to.
reminds me of just an incident when many, many years ago, I had a postdoc from Poland who came with his whole family. This was maybe 20 years ago, and I was just helping him sort of get set up, and he had 2 kids and a wife, and so he needed to hang some stuff in his home, and needed a screwdriver. So I took him to a hardware store, and there he saw was a display of like 50 screwdrivers. He had no idea what to do. In Poland, there was 1 screwdriver. So
that's it, and it's interesting when you see somebody who is coming from a different culture where they don't have that. What I saw, the same thing from hanging out with Tibetans for so many years, is it was so stressful for them. In some cases, I remember being at a restaurant and looking at just these endless items, and they just hand me the menu, say, just choose something. Like I can't. It was like almost overwhelming. But again, it's our normal, so we're just used to it. So before we dive into the data, Daniela, maybe we could just hear a little bit about the human side of this. You've worked with tens of thousands of people over the years and have impacted so many lives. I'm curious if anything comes to mind of all those many people, just real world stories, both capturing the burnout and how these principles and teachings can make a difference.
Thank you, Kurt. This is fantastic. Thank you for this space. I feel very fortunate to be here with my teachers and friends. And so one thing that comes to mind, indeed, I mean, many stories came to mind, but one was this one healthcare professional who, given this exercise of thinking, how would you see yourself in your 100th birthday, right? And he was reflecting and saying, now I look at that and I can see that I can build my future. That this life, the waves of life, will continue to come, but I can learn how to surf and I can learn how to be there. This is not going to change, but I have a better way to be well with myself and for others, right? So I think that really makes I really love the way he
and I imagine that was somebody who he was really burnt out, and I mean, where was he coming from when when you met him?
Oh, definitely. These what we hear so much, from the healthcare professionals and also from other professionals like teachers, but this is like this overload, and this assumption that you have to be there like a superhero, standing there for everyone, and there's even a taboo usually that you can't have, stress or mental problems or just not feeling overwhelmed. So I think this first having someone actually tell you this, like opening up as a healthcare professional between other healthcare professionals, just expressing themselves like this,
just being
means
human
that we're
and
also
vulnerable.
Exactly. I think it is also giving us this. I mean, the story about in that context is that also they see that they can speak about this, that they can help each other, and that this possibility is for their community. No, it's not something else that others can have and they can't because they have to be always well for others, right? So yeah, this is I think a very nice story. But we have many of these also systemic stories. I'll tell you briefly another one about a headmistress in a school. And she was saying at the end of on 120 hour a principal, sorry, yes, a principal, and she was saying, now I come to school, the parents are the same, students are the same, the school is the same, but everything has changed for me, right? Because this idea of something that used to be so heavy or difficult or challenging, now becomes an opportunity or can be taken in a very different way. And I think that really also is a good example of how people see these things change in their lives.
That's amazing. I was shocked. One of the things I heard about the system here in the U.S., I'd be curious if it's true in Mexico, is that one of the highest rates of suicide in different professions is actually among doctors. I was shocked. You just kind of think of doctors as supermen and superwomen, like you just kind of think of them as they're just built differently. But that was pretty shocking. Is it similar in Mexico? Do you have these incredibly high rates of burnout and even things like suicide in your side of the world?
Yeah, I mean, as we were preparing for this study, for the ISTH study, the PIPSE Salud study, we looked at those numbers and they were really high. And interestingly, and also very sadly, for residents, so the highest rates, and now this is kind of a new phenomenon, not only in Mexico, but I think in all Latin America, is that residents going through these incredibly hard times, a lot of stress, leading to burnout, isolation, and all these factors, together with maybe some other additional factors leading to this So these are very young people who started their, wanting to be doctors, nurses, and all of a sudden they're faced with great hardships that maybe they're unable to manage both personally and socially. And we have all these very high levels. So yes, this is happening, and I think now that there's a big concern, at least in Mexico, with residents.
It's crazy to think just starting your career and you're already burnt out before you're even out of the gate. So maybe we could dive into the study. So how did you choose to work in healthcare? How did this even come about? Because it's such a cool initiative and study that you did.
Well, actually, since we started Atentamente, we thought that it was important that we work with populations that had a big impact on society, basically. And there were two components. One is, professions that had a big impact on society on the one hand, and then that for whatever reason they were kind of not taken care of properly or not cared for the way they care for us. So when we talked about this, we started, of course, with teachers and principals as a really important role in society.
You guys have worked now with tens of thousands of teachers and principals. It's just amazing. That's another conversation to have. But just to say as a footnote, Atentamente and you all and your team have just done amazing work in the whole kind of educational system in Mexico.
Thank you, Cord. And yes, we started working with teachers and principals, educators in general, and we noticed that aspect, right? That they're super important for society's well-being, for children well-being, but their well-being is usually I don't know if neglected is a word, but underserved in a way, and to the extent that they experience stress and burnout, it has a huge impact, of course, on their well-being and health, but also on a big portion of society. And the other population of group of people that we noticed a very similar situation was with healthcare providers. And we started working with healthcare providers before the pandemic because, we thought it was very important. But then during the pandemic, the whole thing became much more poignant. We saw, well, these are the people that are taking care of the whole society now. They're really at the forefront of a huge problem for everyone. They're risking their lives. But as a society, we felt we're not really taking care of them. We're not, we can do better. So that's how we started working with healthcare providers, and we found that it's, of course, something incredibly meaningful, rewarding, needed. So that's how we made that decision to start working. I don't know if Daniela wants to add something else about this.
Yeah, I'd be curious, Danielle. Maybe you could share a little bit about what you did. And I think it's such a great study because it also shows that no matter how busy you are, no matter how stressed out you are, because you can't imagine a more stressed out group of people, right? A busier and more stressed out group of people with systemic challenges that are kind of through the roof, right? Like just incredibly difficult systems they're working within as well. And so it's a good test case. Like, okay, if you can do it in that context, any of us, no matter how busy we are, what's going on in our lives. So Daniela, what did you do? How did you actually help all these healthcare workers?
Yeah, well, let me tell you that when we first started piloting this, it was within the pandemic. So it was even a heavier, no, such a heavy load. And actually, part of the response, adding to what Leandra says, is that how can we help these people right now? No, like we need to give them something now. So even within this load, I think what we did, and this paper actually reports this, right? So we tested a 13-week hybrid program because it had synchronous Zoom sessions together with the HMI app accompanying them. And for those 13 weeks, no, I mean,
So
the
by
app,
hybrid, you mean it's there's like the digital app that people do on their own time, and then they had like live, they were online, but live sessions.
exactly,
So it was a like
exactly.
combination of a couple different things, right?
A combination. So it lasted like the program lasts 13 weeks, but I think the beauty, and I'm sure you'll talk more about that, but is that I think with the app, also, this is continuous because you've done with the 13 weeks, but you still have this fantastic instrument, which is the app to accompany you. So we had this program, and after a huge effort, of lobbying and working with ministries of education and hospitals in Mexico, in the public system, we started working in 7 different states. And within those states, we completed a group of more than 2,300 healthcare professionals, not just doctors. There was also nurses, anybody in those hospitals that would be, or that wanted to be in the program, but that also were actually working with patients or just tending to patients, right? So it could be someone in the administration, but it had to be people who had to face patients.
And just to say, in our world of research, this is a huge population. Like this is a very large sample. This is a very large group to be working with. So it's very unique and makes it even more rigorous and important for that reason as well.
Yeah, and it was amazing, and having all these 7 different healthcare systems, because even though we are a federation and we know there's differences, of course, in each state or hospital, but working with this together. So the design was the program was designed to strengthen their skill of well-being. This was the focus of the program. And so it had to cater also for the time schedules that are crazy. Some work at night, some work on days. The shifts are changing, right? So in a way that they could access this in their flexible time when they could be in the sessions or recorded sessions, that they would have the app to accompany them. So we tried to be as flexible as we could to cater for them, for what they needed and their schedules. And also our instructors, they were doctors themselves, right? So this is great because when you have someone there, I think this really helped in many ways, but some of them were that because particularly one of them is a doctor, she's a pediatrician, and of course this gives the healthcare professionals the confidence that they're talking with someone who knows what they live through, right? Because this is the main thing. And of course that they also felt the confidence in that what was being delivered is science-based and something they could also feel that they could trust. And I think that made this into a safe space for them. So that's why we get all these beautiful comments and them opening up about their problems, about how this is helping them, their challenges. So this would last for 9 weeks. We had the sessions, or we had 8 weeks, then 4 weeks just with the app, and then we came back for a closing session. That would be the whole program, to give them more, to build first that we're working with them in the sessions, and then we're trying to help people build the independence in developing these skills for themselves, right? So the app really helps that. And after the closing session, we want them to be ready, to take off with the app and the skills for the rest of their lives.
So maybe we can dive into the skills, at least briefly, because some people listening to this might have no idea what we're actually talking about. Like so what? Like, what did people actually learn? And actually, this is the perfect group because actually it's the 4 of us, obviously Richie and I with the Healthy Minds app, the 2 of you with all the programming that you do with Attentamente. And this was basically the combination in many ways of these 2 things. And the roots of it, even before we built these things, we've been in conversation for years, even about the kind of the underpinnings, the kind of everything that has gone into these programs that we've offered. So maybe each of us could just share a little bit, because we've each of us in different ways has been so immersed in kind of finding ways to take what we know scientifically, what we know from the world's wisdom traditions and meditative traditions, and how do you put those out in the world that anybody could make use of them? So I don't know if anybody wants to jump in, maybe each of us could just share a little bit about some of the skills and maybe how we've practiced them in our own life, since we're all, lead pretty intense lives in ways. Anybody want to jump in first?
Richie, go ahead. You can start.
Well, one of the wonderful aspects of the kind of interventions that we're all working with here is that they're really designed to be used anywhere, anytime. Another way to say that is they're designed to be used everywhere, all the time.
That could be a better tagline than anytime, anywhere, everywhere, all the time.
Everywhere, all the time. And they're really, it's really appropriate for any situation, anytime, anywhere. And so when we do maybe a formal practice where we're really, for example, trying to learn the skills of simply being aware of whatever may be arising, we can bring that skill to an interaction with a patient, for example, where a healthcare provider can really pay attention to what the patient is saying, to how the patient actually is presenting her or himself, to their demeanor, to the coloring of their face. Often a healthcare provider can get insights about the state of health or illness just really from close observation. These are actually such important skills in a healthcare provider-patient relationship. And one of the sort of deep concerns about the modern era is that with electronic medical records, which of course has many advantages and is clearly really important, but there are also some disadvantages because I'm sure that many listeners, many viewers have had the experience of going to see the doctor and having them not look at you because they're looking at their computer. My instinct is to think that a person who had the opportunity to participate in this study in Mexico would be less likely to do that because they would really appreciate the value of really being present. And one of the other things that's connected to being present and this pillar that we call awareness is also being connected, having a kind of heartfelt connection with those with whom we're interacting. And just having that connection is, I believe, health promoting in and of itself. It actually, there's not a lot of research on this, and so I want to be careful as a scientist to say that this is speculative, but all the evidence points in this direction that having this sense of connection actually helps to activate innate mechanisms within the body that are restorative and that can be health promoting, that are healing, if you will. And these are, super simple things that we can be doing every day in our daily lives. I'll just end by saying that these simple skills, for example, I've been talking about awareness and connection, I use them all the time, every day. I just had a meeting with the new dean of the School of Education, and prior to that meeting, I looked at her picture, I read a little bit about her, and I just reflected on how this meeting could really be beneficial for many people that we ultimately serve together, and it really helped to establish a kind of heart connection. And this is a quote business meeting. We ended up hugging each other, and it was really warm and fuzzy. This is so accessible. It's really at our fingertips if we just remember to bring these these skills, to activate these skills, which are really part of our nature in our everyday lives.
Yeah, it's so true. That's one of the cool things. I think these things people don't think of as skills. You don't think of being connected to other people, feeling appreciation or gratitude as skills, but they are. You can practice them. I'm curious, maybe we could just each briefly share a few other things that we found helpful or what you have seen in your work. Leandro, anything come to mind from this point of view of just simple skills and practices that you found in your work or even in your own life?
Well, I've tried to integrate these skills to the best of my ability for a while. So I think just actually, I think that even though we work fairly hard and don't sleep much, but I think because of these skills, everything becomes not only manageable but a joy. I think that in my case, especially connecting with my sense of purpose and motivation is sort of the thing that keeps me joyfully going most of the time. And also, I think regarding the awareness component, just being able to sort of remain relatively calm and steady, not having any additional friction that is not necessary just because my mind is creating a lot of additional friction, I think has been very useful. Of course, connection, it's a big part. Everyone here knows me well, so they know, like just feeling connected.
For those of you who don't know Leandro, he actually won the gold medal in the Olympics of extroversion. So if there was such an Olympics, he would win the gold medal. Maybe we could say that.
No, but for me, this and just actually nurturing that is very sweet because whatever you are, you can, get to connect with the person, whomever you're in front. You're in a restaurant with a waiter or waitress or whatever you are, you can, and that I think that sense of warmth and connection makes it like you're with family. A nice family, not the fighting. Like you feel that sense of intimacy and what do you call like feeling like family, right? Like you feel very happy, and I think it's very useful, especially when you're working with a lot of people. But if you feel like you're connected with everyone in a way, family style, with all its ups and downs, I think it's also quite nice.
Yeah,
And of course,
I've noticed
insight.
actually
Sorry.
watching you, Leandro. I mean, genuinely, I feel like I've learned a lot. I mean, being a gold medal winning introvert myself, where this part is maybe not so natural. Actually, it's been so kind of inspiring. Actually, just you like going out to dinner with you, and at the end of the meal, like you'll know the waiter or waitress's name. You'll thank them by name, and it's just you really feel like they know you, you know them, and that it's for somebody for whom that does not come natural. Actually, it's been seen like, oh yeah, like here's like little things you can do, just learning somebody's name and just mentioning that, and then that person really feels seen and valued just in that little encounter, and then you feel better too. Like it's good, it's a win-win. Daniela, what about you? What stands out for you? What are your little skills, your go-to skills or practices?
Well, I just maybe to complement on what you guys were saying, because I also think that part of insight, of being able to look at the way you're thinking about things, and reconsidering, I think that is so helpful. And I was thinking, like having a broader perspective, or just saying, these are thoughts. No, this idea really does it really stand? If I look at things through a broader perspective, because I think, like for example, in our work with teachers, or even here, I can imagine with the healthcare professionals, sometimes giving yourself time to stop and do maybe a practice where you're training your attention for 5, 10, 12, 20 minutes, whatever. Some people, I mean, they might find it nice, but not necessarily something to integrate into their lives, truly. I mean, just like you were saying, like becoming aware at a given point, that is much more feasible, right? But maybe other practices might not be done by so many people. But I think the point of view, this idea of saying, oh, okay, so my thoughts are they really so accurate of what's happening? Could I see this in a different way? If I know that I'm changing and this person is changing, that this person is having a hard time, how does that information help me? And that connected also to your sense to your values, and you're all talking about purpose, right? Because sometimes you're so trapped, you can't really do much of what you want or attain your goals because you're overwhelmed or in a difficult situation. But you can always think, okay, so I can't go towards my goals, but how can I connect with my values, and how can I be this person? So this idea of using your thoughts as helpers, those thoughts that can be sometimes, really harassing you in many ways. But when you allow to see them, in a different perspective, to have a different point of view, and to rethink or reassess the way you're interpreting something, and have these ideas that I think are so crucial, like the idea of this guy, this person the doctor talking about the waves. If I can understand that challenges will never stop, and I cannot control the situations the way I want to because I want to, but I cannot. But that I can always do something. I think that idea in itself is really powerful. So insight, I think, helps me a lot.
This is so great. Yeah, for me, when I think about my go-to practices, actually, I don't have to think too far back, because actually even right before this, I did this little practice that I do all the time, which I like to think of as just sort of shifting from doing mode to being mode. And we just have so little space in our lives to unplug. I mean, going back to like the electrical, kind of way houses are built, it's like we just have this constant flow of intense kind of information moving through our system, emotions, thoughts, all sorts of stuff. The world is just constantly layering stuff on us, one thing after another. And so for me, just taking, sometimes it's 30 seconds, sometimes it's 5 minutes, sometimes it's 10 minutes if I have more time, but literally just sitting there or lying down if I'm a place where I can do that, and just not even needing to meditate, just being very effortlessly present. And just, it feels like all the stuff that's building up in my system just has space just to kind of release a little bit, to unwind a little bit. And I'm not even really trying to do anything. It's just letting go of the effort to do anything, even to do meditation. That space for being in my life is so vital, even if it's just a few moments between meetings, or turning off a podcast if I'm driving somewhere and just injecting a little being into my day. So for me, that's been super helpful. So this is what you guys were teaching, right? You were teaching this to all of the healthcare providers. You were giving them these skills. We've mentioned a few of them here, but in a more organized way, of course. For those of you who are interested and want to learn more about this, you can download the Healthy Minds app. You can check out Attentamente, and you'll get more than you ever wanted to know about this stuff. But it'd be great to hear about the results of like what happened. And Leandro, I don't know if you want to jump in before we get there, but it'd be great to hear a little bit about what happened, what you learned from teaching these skills.
Well, I can. I just want to say something very briefly about this, or ASIP skills, or ABC del Bienestar, as we call it in Spanish. And
ASIP, for those of you who don't know, this is our like inside baseball language, which is awareness, connection, insight, and purpose. It's like the four dimensions of flourishing or well-being. So we're all talking around this stuff, but that's kind of what we're referring to.
And just because everyone is here, and I want to take the opportunity just to ask my friends what they think. But when I've been thinking about this, ASIP, or awareness, connection, insight, and purpose skills, I'm thinking like when you think of a complex skill like dancing, you have dancing is quite difficult, I think, for me, super, super difficult. But
For some people like me, actually impossible. But yes, for most people, it's difficult.
but I actually can appreciate and I'm admired by that. And essentially what I was thinking is that, for dancing you need like these basic skills. You need rhythm and maybe strength and flexibility and coordination and like bringing it all. So strength, flexibility, coordination, and rhythm, right? So if you have those four, then you can learn so many different ways of dancing. You can dance classical, but those are kind of basic, and they work together in a slightly different way for different kind of situations. And the way I think about these ASIP skills is that, they're very important in themselves, but also as they come together, they make us sort of more resilient human beings, because of course collaborating with someone or dealing with hardships or it puts in motion all these skills that are happening together in order to, let's say, cope with a very difficult situation. And I think also for me it's useful because it's not only that you're developing these unique skill sets, but also they support each other in ways that allow us to be much more flexible and resilient and managing life's difficulties in healthy and creative ways. And I was wondering, Richie, Cord, Daniela, what do you think about this? Because in my experience, it's also, they all support each other in a very nice way. Before I tell a little bit about results.
Yeah, Richie, you want to chime in on that one?
Yeah, well, I certainly would agree that they all support each other and there are synergistic effects from one to the other. From a scientific perspective, we really don't know a whole lot about it. I think there's a lot of insight from the contemplative traditions about ways in which certain components may support and benefit other components. It hasn't been tested a lot in the scientific framework. So just to give a simple example, it's often assumed that developing some basic skills of awareness is really helpful as a prerequisite prior to the development of other skills like in connection or insight. That's one way to think about that, is that that's a hypothesis. We really don't have a lot of good evidence that we can point to scientifically that that particular sequence is the best for most people. It may be that it's really great for certain people, and it may be different for other people. And so, one of the important outstanding questions is raised by this possibility, which I think is probably likely, that one size does not fit all. There's an opportunity, I think, in the future for tailoring in a more personalized way a path that might be particularly appropriate for a particular person.
Richie, would you say, I mean, from a meditative point of view, if you look at the world's meditative traditions where you have these things are thought of as practices and skills that you're working on, I would say it's universal that there is always a repertoire of skills. It's not like you're just learning to be mindful or you're just learning to be kinder and more compassionate. Really, across all these traditions, there's always something related to meaning and purpose. There's always something related to interpersonal skills. There's always something related to insight and wisdom. And of course, you need to be aware and attentive to do any of that. So it seems like although the order, the structure, how it's the wording and the terminology and the jargon might be different, you have these universal themes. I'm curious from a scientific perspective, although the science is quite early, what would you say about that? Just the idea that it's not just having one particular skill is likely not enough or going to be as beneficial. That kind of repertoire approach, does the science support that, do you think?
Yeah, I definitely think so. And, you know, you and I have talked a lot about this before, Court, and I've talked to Daniela and Leandro about this too. And um, in the West, when we think about research on meditation, for kind of historical reasons, mindfulness has been privileged. And, you know, some people think of all meditation as mindfulness. And one of the important correctives, which I think this discussion bears on, is that there's a lot more than simply mindfulness. And in order to flourish, we need all these different components. I sometimes liken it to, you know, going to the gym. If we just worked out on our upper body, you know, it'd be good for our upper body, but actually after a while it may even lead to some imbalance. And so we need to cultivate all of these different elements to really truly flourish.
So with that in mind, maybe we could jump back to the impact, what actually happened, and would love to hear both Leandro, some of the data, which again was just published in this very, very prestigious journal. I mean, it shows how important these findings are. It's not easy to get them published in a journal like we have, and we'll share the link for all of you listening. And Danielle would love to hear, in addition to the data, just some of the, you know, the real world stories and impact too. So maybe we could just start with, you know, wherever you want to jump in, but what were the results of all the work?
So maybe I can say something briefly about results. So the main goal of the study was to see if we could, through this program, improve well-being and reduce psychological distress, you know, stress, anxiety, and depression in healthcare providers, and also to what extent were this awareness, connection, insight, and purpose skills, if they also improved, and how they mapped or how they related with changes in well-being in healthcare providers. So we were very happy to see very meaningful results. We saw improvements in well-being after the intervention, but I think most importantly and encouragingly, the effects remain 6 months after the intervention. Not only remained, but improved, so got bigger, the effects got bigger. Likewise with anxiety, depression, and stress, we saw statistically significant reductions in anxiety and depression, and also the effects got larger 6 months after the intervention had already finished, which is very uncommon. And I think that we also saw reductions in burnout, particularly in emotional exhaustion of burnout, which is this feeling that you're really no longer can, very tired, and you can no longer, you cannot deal with one more thing. That's sort of the feeling of emotional exhaustion, and personal accomplishment, feeling that you're no longer good at what you work. So those were the main results, and something interesting related with the sort of awareness, connection, in the insight and purpose is that we found that at least for Mexican healthcare providers, the two things that had sort of the heaviest impact on improving their well-being was awareness and insight, which is slightly different to what has happened with US samples, for example, with teachers.
I was super interested by that. Yeah, I mean, as you all know, and for those listening would not know this, but we did a very similar study in the educational system in the US, but in that context, actually it was connection. It was learning skills related to appreciation, kindness, and compassion that was quite far and above awareness, insight, and purpose, the other three skills. But you found awareness and insight were kind of the main drivers. So that's interesting that there might even be, it might be cultural differences, or it could just be a different time. And it could be just, who knows? We don't really know for sure. But I thought that was fascinating, that what you found with that.
Yes. And we didn't know what to expect. I think that's one of the really interesting things about these studies, that you really, you have some hypotheses, but you don't know what's going to happen. And it was very
intuitively,
encouraging.
Mexicans are not lacking for connection.
That's what I was thinking. That's what I was
You
thinking.
guys are
It's
like
not what we're.
you guys are like the world experts in how to do connection well. Whereas in the U.S., especially the Midwest where we live, maybe we have a little work to do in that area.
And maybe Daniela can tell a little bit about, some of the stories that, provide some warmth and juice to the numbers or, formal results of the study.
Thank you, Leandro. Yeah, I mean, but it is true that Mexicans have very usually tend to have very close familial and friendship bonds. Yeah, that is true, for sure.
If we can do a little study, the number of times per week that we each call our parents, and like me compared to the two of you, I think we definitely can say definitively Mexicans are far ahead in that particular race. Sorry, Mom, if you're watching this.
Anyway, but one thing we always love, there's this one story that we always share about this nurse because she's so sweet, because she's saying like, I went to see my doctor and he says, but what are you doing, lady? What are you doing? Because she says, your health is better. All your ailments have improved, and she's like, I'm not seeing the psychiatrist anymore. I don't even go to the psychologist. I'm feeling so much better. And she says, this idea of being friends with my stress, this is the best. And the stress is my buddy. I really enjoy this. And, so of course she's saying this personally, but it's very beautiful that she goes all the way into her actual health, like that she's having a health follow-up, and this is actually impacting her body and impacting her, well, even mentally, of course, right? So both things there. So she's beautiful, and we also hear, like, oh, I'm here, and that people are asking me, why are you always so happy? Like you're working triple shifts. No, you're already in your third shift and you're still smiling, And she's like, well, I've always been empathic, but now, I feel like makes so much sense for me, and that I can bring this, to my team. And one doctor, another doctor was really beautiful because she said, like before, she was like the head doctor, in an area, and she was like, I didn't have friends in that area, and I was there like to supervise and to take care, to make things work, and now I come and I see my colleagues and I really think about them too, and how can we work together, and now I have friends in all my colleagues. Like it was a complete like shift for the team. And I think that is also so important, that the shifts that are personal, that many of them report that this is helping their family life, because it's not something that so I'm a person here and I'm not a person at home. So of course you're a continuum of a person, and you bring work home, you bring home to work, so this is helping them in their personal life. It's helping them in their professional life. And I wish we knew more what was going on with the patients, but I think, and I'm sure, not for what they say, that their teams are better, they feel better, and they can, like Richie was saying, that they feel that they can be with people better, tend them in a better way. So I think these are really wonderful stories to hear.
It's amazing.
And I just want to say something that now that I was hearing Daniela reminded me of a story of a nurse that told me something that I had forgotten, and now that as I was hearing Daniela, I remembered. And I thought it was, very descriptive of burnout and how it happened. And she told me, I didn't notice how burned out I was. It was like it happened over time. It was not so sudden, and all of a sudden I just felt like, she said in Spanish it sounded very nice, but it like my juice got dried. Like she said, I got dried up inside, like I lost my joy. And then she said, well, as I started doing these practices over time, it was like a light came up inside. She said, my juice came out. And I all of a sudden remembered that I really liked my job. But it was the burnout process had been so over time that all of a sudden I felt like disconnected, no longer joyous at work, but I didn't notice. I was just like,
yeah, it just sort of creeps up. It's not like one day you get burnt out. It's just like this very slow
and I thought that was, because that's one of the critical things about burnout, that as it happens over time, you just get used to this new way of being, just less happy. like and all of a sudden that becomes your new normal, your the way you now relate with the world, and you just say, well, and then reconnecting with this, she was beaming because she said, I really loved my job when I started it, and then all of a sudden with more responsibility, all these things, they started I got dried and all, no joy. And then all of a sudden, just going back to my purpose, going back to these practices, reconnecting with people. All of a sudden, I'm like happy again. I'm like just happy to go to work. And she missed that because she started doing it and she really loved helping people. But after a while, it just kind of lost. But it was interesting. I thought that it, kind of lost without knowing, which I think for some of us that might
Yeah,
be the case.
we
All
heard
of a
that.
sudden,
We've heard that over and over again from teachers where they say things like, yeah, I remembered why I started teaching in the first place. And you just kind of gradually forget. It's not like you forgot one day. It's just sort of, and it just feels like it just is how it is. You don't think that it could be any other way. So I think that, this has been an amazing conversation. And again, congratulations on this really, really important research. More importantly, congratulations just on all the work you're doing, not only in Mexico, but just, being a role model for how we do this in the modern world. To me, the takeaways here are just zooming out to burnout more generally. I think first and most that although it feels personal, burnout is really just a predictable response. Our bodies and minds and brains and nervous systems responding to just the crazy pace of the world we live in. It's not a personal failing. The good news is that what your research is showing, what the work that Richie, you've been doing for decades, is that it really can be minutes a day. And learning these simple skills that, as you said, Richie, you can do anytime, anywhere, or what was it? Every time, all the time, everywhere?
Yes, all the time, everywhere.
All the time, everywhere, right? So it's much easier than you would think. Literally minutes a day, or really not even changing what you're doing, but just bringing a new perspective into the things you're already doing. So it's very possible, no matter how busy, no matter how stressed out, no matter how burnt out you might feel, that it's really possible for anybody. So Richie, I'm curious, you want to maybe take us out and any kind of final thoughts that might be helpful or inspiring to everybody watching here?
Well, just to say that one of the inspiring qualities of the work that Daniela and Leandro are doing in Mexico and other parts of Latin America is working with sectors that are really suffering, like healthcare providers and educators. And the work that we're talking about today that just published in JAMA is purely a digital implementation. And these strategies really are highly scalable. And these needs are becoming more and more significant all over the world. And one of the things that we're learning is that even short periods of engagement can be very helpful. And so I think for viewers, the really important take-home message is that we really do, I think, have the tools available now to highly scale these kinds of approaches. And if we bring it to different sectors, sector by sector, we really have an opportunity to change the world in ways that I think all of us agree we critically need to do. And so I'm super excited about this work, and also just deeply grateful for Daniela and Leandro's commitment to this, particularly in developing parts of the world that I think really can benefit from these kinds of approaches and may not even know about them. And so I think the future is really one where we can have a real sense of hope and optimism that things can change for the better.
Thank you so much, Richie, and thank you, Daniela and Leandro. Wonderful to have a good excuse to hang out on a Friday afternoon and hear about all your amazing work. So thank you for joining, and hopefully the first of many. I have a feeling this is not going to be the last time we'll have one of these conversations in Dharma Lab. So thank you so much for joining us.
Thank you so much. I hope this was beneficial to our listeners, and thank you for this space, and thank you all.
Yeah, thank you, everyone. It's such a joy to be with friends talking about things that we find meaningful and passionate about. Thank you so much.
All right, bye everyone. Have a great day.
Bye bye.